I've been in the aesthetic field now for over 16 years. I own a practice just outside of Pensacola, Florida with my husband, Jerry. Our practice is called Skin and Tonic. And so in our practice, we started out with injectables like many of you. And over the years, we've added multiple energy-based devices and, have made mistakes along the way. And so I want to make sure that we're going to talk about this particular technology and why I like it and use it extensively in our practice. But also I'm here to help guide you guys and answer any questions that you may have if you're struggling with those decisions as to what devices that we found successful and which ones we've kind of struggled with implementing as we brought them into our practice. So how many of you are familiar with Plexor? Anybody have it now? I see you over there, June. I know you have it. Any of you guys have one of the Plexors? Great, so this is going to be new information for you guys. So kind of the way the morning is going to go over the next 40 or 45 minutes, what we're going to do is I'm going to show you some before and afters to kind of grab your attention, because I think it's pretty impressive the results that we can get with the Plexor, what you can see that we can accomplish with this device that really is quite simple technology but effective. It's something that we can carry around in just a little handpiece in our lab coat pocket and do some really drastic treatments. We're going to review the technology, how this device works, and what sets us apart from other devices that look similar. And then we're going to go into some protocols. And so for those of you who have the Plexor, maybe these protocols will be new for you. We'll go over what we do to prepare our patients for the procedure, as well as how we perform it and the aftercare, because that's equally as important as the procedure itself to really get these results that we're going to show you, these drastic before and afters. So again, I'm just going to start with this. So when you look at this, any of us will cringe when we see that patient walk into our practice and we're like, what can we offer this type of patient? What are the things that we have available? And many people would say this is going to require some kind of aggressive resurfacing, multiple treatments, or even maybe surgery. And this is a result of one treatment with the Plexor. And so you can see this is, great before and after. If we could get this, on all of our patients, wouldn't they be happy? This would replace a lot of our injections. And so when we go over different things that we do in our medical aesthetic practices, one of the things that we have to consider is the business aspect of this. So we all do it because we love having great results. We love having, patients happy and patients return. But in order for us to do that for many more patients, we have to make a living at this. We have to make our practices profitable. And so if we're doing that and we're losing money, or we're not making as much profit as we can to replace our salaries from the hospital or whatever background we're coming from, then we're not going to be able to continue to serve many more patients and get those type of results. So the other thing that I want to talk about, this is one treatment. The disposable cost to deliver this type of treatment is $20 plus the aftercare. So this is a treatment that we can charge quite a bit. There's a huge ROI for this. Get results that our patients are going to talk about, their friends and families are going to see. They're going to come back to see us, and we're going to have a profitable practice. This is another nice result. You'll see that we can use this directly on soft tissue, so we can use this on the lips. We can do lip corrections with this, nose corrections with this. And again, I'm just starting out with some of the more impressive before and afters to get your mind thinking what we can do with this. And then at the end, I'm going to take some questions. So if there's challenging cases you have or things that you want to know more about the device, I'll be happy to take questions. This is an upper blepharoplasty that we can use with the Plexor. This is probably one of the most common indications and one of the highest patient satisfactions that we see people come in for use of this particular device. So there's very few things that we can use directly on the eyelids without using intraocular shields and numbing and all kinds of other stuff if we're going to do something like maybe a CO2 laser. And then there's a lot of downtime associated with that, and it's going to be multiple treatments. With this device, using this type of energy in the ablative mode, we can actually sublimate, and we're going to talk a little more about what that term means, but we can sublimate or remove tissue, and as that heals, we will get tightening and a lifting of that area. And so this is a procedure that you can do in under 15 minutes in your practice. You can charge, $1,500 to $2,000 depending on the area that you're in for this, and patients will pay this all day long.
Are all of these one session?
This is 2 sessions, so I'll try to point out. So they're usually 1 or 2 sessions, and so I'm going to go, again, I'm just going to show you some drastic before and afters, but then as we get into the protocol, I'll tell you how we determine how many sessions that we're going to use for the treatment. Okay, so this is just a simple demonstration or a picture of what the workstation looks like. You guys feel free to come up. We have one up here to show you. We have a booth in the exhibition hall, so you can go by and see the device if you want to put your hands on it. If you want to try a treatment yourself, one of the Plexor showers that we have here, we'll have that at the booth, and you can come by and try one of the treatments. It's no downtime with that, and you'll see that it doesn't require numbing. It's not painful. So stop by and see us at the booth if you want to see it a little bit more up close. The thing that you'll notice is it's a very portable station. So this is something that's easily moved around. And so I don't want to get a lot into the technology piece because I want to go over the protocols with you guys. But just so you know, if you haven't seen it, it's all self-contained in this little box. It's the one sitting up here on the front table. And there's 3 hand pieces. So there's a low, medium, and a higher wattage or higher power hand piece. And depending on what treatment we're doing and the patient's skin type, that will then help drive us to make a decision as to which handpiece we're going to use. Now, each of these handpieces work independently of each other. So they charge when they're in the base station, and we can program them. We can send a signal to them where they're going to work either in a continuous manner or a pulsed manner. We can set how long those pulse durations are. But once that information is sent to the handpiece, I don't need the base station any longer until the handpiece is fully discharged, so meaning we've used all the energy. So the great thing about that is I can have all 3 of these devices working independently in my practice at the same time. So I don't have to have the machine tied to the handpiece. I can program it, take that with me in my pocket, and I can be doing an upper blepharoplasty in one room, and the esthetician can be doing a Plexor shower in another room, and maybe Jerry, my husband, can be doing a cat scratch in the third room. Or I can put it in my luggage and take it with me, which I do often. So I teach a lot, I travel a lot, and as I'm going places, I just have the shower tip with me, and I want to have a nice glow for the weekend wherever I am, so I throw it in my luggage, and it's programmed, and it will have a charge for at least 4 to 5 hours, and so as long as that charge is there, it's going to deliver, the energy is tied to the handpiece, and it's going to go wherever. So I don't have to have it tied to the base station except for charging. So that makes it really handy. And if you have multiple rooms, it's great because we can have 3 devices running simultaneously. And then there's a little smoke evacuator that comes along with this package. Basically, as we sublimate tissue, it does get a little bit smoky. So really what we like to focus on when we talk about Plexor, and I encourage this for anything you do in your practice, is results, because that's what you're really selling your patients. We're not selling them a procedure, we're selling them a result. So when they come in, we know this. Some of you guys, I know, were present for the Galderma workshop that I did the other day, and you know that all the companies are leaning towards, let's do treatments that really focus on results. Let's try to get away from selling a vial of filler or 20 units of a neurotoxin. Let's sell a result. What does a patient really want? What bothers them? And how can we deliver that result? And so because that's what really matters, that's what we focus on with our energy-based devices, but specifically with the Plexor. So you'll see that we can do upper lids and lower lids. Lids in general are something that really bother a lot of patients, me in particular. And so this is something Arash is going to do for me. I just haven't had time away from speaking long enough, but this is something I'm going to do with my lower lids, is Plexor, because it's what I consistently see the best results with when we're working on the lids. Now what you'll notice is the little dots, those little black dots, and that's a pattern. That's where we're going to deliver the energy. And so because this energy is being delivered into the tissue, we're going to do something called sublimation, and that's really, sublimation is where we turn something from a solid state immediately to a gas. So we're going to skip over that water phase. So it's going to keep this from causing a lot of heat within the tissue, which is what leads us to problems like post-inflammatory hyperpigmentation. So we really don't see that with this device. Now, how many of you have heard of something called a plasma pen? Most of you. Have you seen problems? Any of you seen problems with the plasma pen in your practice? Not really. So I can tell you, when I first saw the device, this device, the Plexor, actually, when I first heard about this device, it was from our colleagues in Canada. So I did a webinar with them, and they were telling me about this Plexor device. And I thought, what is this device they're talking about? It looks like a plasma pen. I see the little dots on the skin that look like a plasma pen. And in my practice and in my mind, I was like, I don't want it, because we had dealt with a lot of scarring from that. And so plasma pen is a brand, but that term has been used now throughout the U.S. for people buying devices that are not medical devices, they're not medical grade, and they're not regulated. So some of them are bought off Amazon. And really, they're functioning more like electrocautery devices. And so it's not delivering true plasma, it's delivering electricity. We're heating up the skin. It's stimulating those melanocytes. And so a lot of people then are having these problems with post-inflammatory hyperpigmentation or scarring from it. Now, some people are getting very good results, but they're variable. So if you're scared from those type of devices, I don't want you to look at this and see the dots and confuse the two. So this is a totally different technology. This is not a plasma pen. It is a Plexer plasma energy-based device, and we are delivering pure plasma. And I'll tell you why that's important. So as we talk about the science of plasma, so plasma is the fourth state of energy, right, or matter. So we have solid, liquid, gas, and then there's plasma. So plasma energy, if you want to think about that, the best example I have for you is the sun. When we look up at the sun, that is a giant ball of plasma energy. And so temperatures get really hot when we generate true plasma. So you'll see the temperature there is 20,000 degrees Celsius. A laser is going to generate up to around 300 degrees Celsius. So there's a huge temperature difference. So when we talk about that, I often get asked, how can we deliver something that hot without scarring, without causing post-inflammatory hyperpigmentation? Because we know heat is one of the things that contributes to it. And this principle is why we can do that. So let's say we have a log. This is the best example that, to me, this drives home with me when I saw this. If we use some sort of laser energy and heat that log, we can turn it to charcoal. We do that because we heat it up, it removes all the water, it chars it, it'll burn it. But usually that charcoal or that wood that we have left is lighter than the log that we originally started with, because we've removed all of that by heating it up. But in that process, we do have some of that liquid that gets heated. The tissue around it gets heated. And that's where we get this inflammatory process. With plasma, we actually heat it so hot, so quickly, it removes that tissue, or it sublimates. So that's where that term sublimation comes in, where we're turning it straight from the solid state, the log, to a gas, and it's going away. So the tissue is no longer there, and we're doing that quickly. So we're skipping over that phase where we're going to have the liquid heated up, the steam within the skin, where it's going to hold a lot of that heat within those superficial layers of the epidermis. And so that's how we're able to do this without having problems with post-inflammatory hyperpigmentation. Now you'll see this is what the device looks like in use. It's basically, this is a treatment on an upper lid. You'll notice that we're going directly on the actual excess tissue. So we're not going between those lines in this treatment. This is the ablative form, this is the ablative tip, and everywhere those little dots are being placed, it's actually, you'll see a little bit of smoke there, and it's removing that tissue totally. That will heal in about a week. So sometimes a little bit longer if we're a little bit more aggressive. If we're not doing it quite as aggressive on a younger patient, it's going to heal a little bit sooner. So remember, the healing is going to be directly proportional to that patient's ability to generate collagen and heal wounds. The younger they are, the healthier they are, the more quickly they're going to heal. Older, less collagen production. If they smoke, if they're a sun worshiper, poor diet, they're going to heal a little bit more slowly. This is an example of removing pigmented lesion. So these videos are sped up for purposes of demonstration here. But you'll see we just go and we can totally remove a pigmented lesion in one session. You'll notice when this is done, they'll wipe that and it's gone. This is one of the most impressive ones. You put that on your website, patients see it, and they come in all day long because now they want all their dark spots removed. Now, that does take a little bit of time when we do that to recover. So that's going to be, it looks great right at that moment. It is going to turn a little bit pink. It's going to get a little crusting on it. And that also is going to take around a week or so to totally heal. But now that spot's done. We're not going to have to bring them back for a series of treatment. So other devices that we use in our practice, and I have, I'm happy to talk to you about all the devices I have. But I would have to set them up for a series of treatments. So I would have to have them come in multiple times over 3 to 6 treatments that they're going to have to come in to get a similar result to what we're going to get with one treatment with this. This will require a bit more, social downtime. We have things that we can cover it up with, so it's not like a giant red spot, but it will be a little bit more red and inflamed for around a week. Okay. Now, when we're talking about plasma and the Plexer in particular, I think this is a great demonstration of where we're delivering the energy. And so when we look at a laser or even an RF microneedling, things like we're delivering that energy deep down into the dermis, that is when we get this big area of thermal damage. So you're going to see we have the gray, the darker, and the lighter gray. So one is where the thermal damage is occurring. That's going to be in the larger gray or darker gray area. And then in the middle there, you're going to see where we actually get necrotic tissue. And so we've seen that. Any of you guys who have seen aggressive lasers will know that we get quite a bit of necrotic tissue, and we have to go through these phases of wound healing. The end results are usually good in a lot of patients if we can really prepare them properly and select them where they don't end up with some sort of long-term scarring, but there is a fair amount of necrotic tissue. With the Plexor device, you'll notice that we're removing tissue, but because we're heating this quickly and skipping over those phases, look at those areas. It's all in the more superficial layers, and we're really not getting a large area of thermal damage. So that's the great thing about this. That is what makes this safe to use on all skin types. So the next, one of the next common questions I get is, what about skins of color? Can we treat Fitzpatrick's 4, 5, and 6? And the answer is absolutely yes, we can. Now, there are a few things that we do a little different with some of the protocols when we're doing our ablation, but we treat all skin types with this device, and we don't have problems with PIH. Okay. One of the things, and I put this here, most of you, anybody in here an ophthalmologist? No? So I think this is just a great example of safety. So none of you will be doing these treatments, but it's one of the few devices that can be used directly on the ocular surface. So it's that safe that we can use it to treat conditions on the ocular surface. It can be used intraoral, so people use it, dentists use it to treat problems in the mouth, on the gums. So it is a very safe technology. And so it's not that you'll do these treatments, but you'll see that this can be used, the same device, directly on the ocular surface without causing long-term problems. So that's why I showed this, is again for a safety demonstration, not that it's something that you'll be doing yourself if you're not in ophthalmology. This is some histological slides to show you the proof of efficacy and longevity. I don't really love, you guys, everybody in this room loves slides. We all love science, we love data. We want to be able to show why the procedures that we're doing are effective, why they're working. So great, we have data to show you that. This is not effective in terms of marketing to your patients. They could care less if you have data to show that it works. They just want to see the results. So they're much more likely to be impressed by those first photos I showed you. The lady with the really severely wrinkled face, and you can show the before and after. That is what your patients are going to love seeing. Not so much that you can show them a histological slide that shows that there's increased collagen production, that there's improvement in the dermal matrix architecture. And so we have triple depth remodeling, and we're going to talk about what we mean by that. But this is what we're doing, is stimulating collagen, and we have access to these studies. If you decide to buy one, or if you want that, we'll provide you the references so you can read the whole study yourself. Results, how long do they last? So it depends on what we're doing. So if we're doing something that we're going to talk about today, when we talk about our glass lift or our nanoablative procedures, that is going to be something that we're going to say somewhere maybe around a year. Depends on if we do, how many series we do, if we're doing that more routine, if we're spacing that out. If we're doing the semi-ablative or the cat scratching technique, which we're going to talk about also today and this morning, that's going to be up to 2 years. And if we're doing something where we're removing tissue, so like those eyelid surgeries, or the brown spots, or skin tags, or any kind of mole, we have some pictures we'll show, that's permanent. That is not going to come back. Now, if they are prone to hyperpigmentation and they get back and they start worshiping the sun again and they're out tanning every day, they're probably going to get some other areas of hyperpigmentation that you're going to have to treat. But once we physically remove a spot, that is not going to come back. The aging process will continue, and so that's where we get this 5-year slide. Okay. This is one session, and you'll see that around the perioral area, you can get, this is probably the second most common area requested for ablative treatments outside of the eyelid is going to be the barcodes around the lines around the mouth or the perioral area. Many of us struggle with how do we treat that with injectables. Hands are often an overlooked area. So any of you guys, I know a few of you were on the in the Galderma class the other day, and you saw me do live injections with putting a hyaluronic acid filler in the hands. But one of the things we couldn't discuss because it was sponsored by Galderma and we couldn't go off label is what do you do with the skin textural issues? And so that is where I bring in my energy-based devices, because as you can see with volume loss in this slide, there's a lot of skin dyschromia. And so if we don't treat that skin discoloration and those dyschromias, the hands are still going to appear old, even if we fill them up and make them perfectly smooth with filler. So this is where we can use combination therapies without having to, or in that one case, you'll see that we didn't even need to do anything but the plexer, so we didn't even need to put filler in. But if you're going to use filler, don't forget about the dyschromias that can be treated with our energy-based devices. The treatments are really unlimited, and so I'm hoping that to give you kind of a wide sampling of things that you could treat with this. So you'll see it's anywhere from telangiectasias to tissue laxity to deeper lines and wrinkles, and even keloid scarring. We can remove those with this device. So just some nice before and after. So this is an acne session, and so this is a device that we can use to treat active acne as well as any acne scarring. And so we know with many things in our practice we can't treat active acne. We can't inject over that. We're trying to calm that down. We're trying to get that inflammatory process calm before we do treatments. So with this device using plasma energy, we're able to actually treat the active acne. It's going to help minimize the bacteria that's on the skin surface, and then hopefully we're going to mitigate scarring, but if not, we can use this to help treat the scarring after it's healed. Again, this is going to be 2 sessions for this one, but you can see quite a difference in the result there. Now we're going to start moving into the actual protocols so we can make sure we get over those, cover those in our time. This is actually from my practice. This is a patient who had 2 treatments. And she came in when we first got the plexer to be a model. And so she had never had any aesthetic treatments at all before. And you can see her before picture compared to her second session of after. I was blown away with this result as well. I'll be honest, this is not what I expected. This is not what she expected. So of course, because it's such a drastic result, you're going to see it posted on everything that I do, right? We all post our best befores and afters. And so this is an example of what can be done with our plexer shower. So a lot of people think that we were doing the cat resurfacing on her or something that was semi-ablative or more aggressive, and this was not. This was actually, she was a model for a training session for my esthetician on doing the plexer shower. And so she saw a model call. She's like, she's a nurse in the OR, and she was like, I really want to come in and try this out, and I'll be a model for that. So she came in. This was no numbing, no downtime. She was like, are you sure I'm going to have a result from the treatment? Because it really wasn't that uncomfortable. And I was like, yeah, you're going to have a result. And I thought she's going to get a nice glow. She'll be happy with it. But obviously, I did not expect that after photo. And now she's like, I've got probably a dozen other patients from her because she's so happy with her before and after. Now, I think it wasn't just the treatment, so I'm going to go over a product line that we use as well to stimulate collagen. So I think a lot of it was the product we use with it and the aftercare as we were, helping her through her recovery process. But you can see that we get really, from a minimally or a nano-ablative process with no numbing, you can see these pretty drastic results. This is another patient from our practice, and this is someone who had dealt with this mole above her upper lip that you can see there for years. And she's from Portugal, so there was a lot of concern about scarring. So all the options that she had been presented to treat this and to remove this had all involved some sort of risk of scarring, and so she kept opting not to do it. But she told me, I feel really awful. My son is graduating high school. I don't want to pose in any of the photos because I hate seeing that, so I want to pose to the other side. I feel uncomfortable when my husband goes to kiss me because all I think about is that mole, and that's what he's focusing on. None of her family cared about that. That was her mom. She had had it their entire life, but it bothered her. So when we had the device, I was like, we can remove it. It may take a couple of sessions because I don't want to be too aggressive. And I'll be honest, I was a little bit conservative because I'm like, I think we can get rid of it, but it's a pretty significant size mole, and you may have some darkness on your face afterwards. Arash is coaching me through this, and he's like, no, she'll be fine. And Arash is the owner of Med Results and has extensive experience with plexer. You guys will meet him at the booth. He's taught me a lot as I went through this. Anyway, we treated her. That's one treatment. That's her afterwards. That's a quote that you can see that she actually texts me, where it's like, "You've changed my life." And she has so much confidence now. So it is something where, yeah, we can treat lines and wrinkles and get those great before and afters. But this is one of the things that I love about aesthetics, is when we can actually kind of impact their quality of life and give them their confidence back. So this, again, shows that we can treat different Fitzpatricks and pretty aggressively with minimal scarring. So you'll see this is another treatment, and you can tell, see a darker skin patient here, and she was treated with an Active Reverse biostimulant. That's a product line that we'll talk about afterwards, and no filter. And again, look at that before and after. It's amazing. That's just some prices that you can see for packages there. Oh, the one thing I do want to pull out on this that's been kind of fascinating is the tattoo removal. So you can use it for tattoo removal. We didn't really market it for that. We didn't use it a lot. We had a Pico laser that we use for that, but then we do a lot of permanent makeup and a lot of corrective work from other artists that have had kind of things that went awry, and we have to fix it. So some of the other lasers is hard to use around the eye, especially if they've went in and done eyeliner where they've kind of smudged it, or they've had larger, they kind of want the wings on their eye, and then they decide they don't want it any longer. And so this is a great device that we have that we can work right on the eyelid with no intraocular shield and remove tattoos. It's usually a few sessions, but we've had really great results. So the protocols that we'll go over, it's going to be our plexor shower, the fractional cat resurfacing, and we'll touch briefly on the soft surgery. So that's the more aggressive form. So the plexor shower is what you saw in that first patient that I was showing you, the older lady that came in for the modeling call. And so this is going to be where we use this triangular shaped tip. And so you can use different energies. So we can use either the low, medium, or high energy, and we can go over the protocol specifically if you want more detail about why we would choose one. But basically, the idea is that we're taking this plasma energy and we're spreading it out across this triangular shaped tip. That plasma energy now is creating micro channels within the skin, which is going to allow our product, whatever our active product that we put on, to penetrate more deeply. Now the plasma energy itself, so if we don't put anything on, we don't do anything with it, it's going to stimulate fibroblasts, and those fibroblasts are going to then make collagen and elastin. And so we know that we get some stimulation of that just from the plasma energy alone. The more aggressive we are with that tip, so as we start moving up either our strength or we start changing the shape of the tip that we're using on the actual device, we focus that energy into something that's more narrow. So rather than delivering it across this wide triangular shaped tip, we can focus it down and come out just one needle point. And that's going to be a little bit more aggressive. So that's how we step up these treatments. But with this triangular shaped tip, it's really, I say non-ablative a lot. It's technically nano-ablative, so it's making all these micro channels. So similar to microneedling. And so, this to me is a more effective form than microneedling, but it was very hard for me to convince patients in the beginning to try it, to trust me, let's try it. Because it didn't hurt, and we didn't need to numb them, and they think if it doesn't hurt, I'm not going to get a result. So how many patients think that you have to hurt them, you have to burn them, they have to have some kind of drastic recovery process to get a good result? And if they don't go through that, they think we're not getting a result. So just like the first patient I showed you, she's like, "Are you sure I'm going to get a result? Because that really didn't hurt. And I really didn't have to go through a long recovery process." And so that's the beauty of this device. So I'll tell you, any of you who have had business classes with me know that I always tell you, think about where your price should be, your final price. And if you're going to do a special to get people in your office, do it for a short time, but let them know what the real price is. So if it's going to be $1,000, advertise it's $1,000. In my first 5 patients, I'm going to do it for $500. Don't say it's $500 and then try to jump to $1,000 a month later, because they're going to say, "What did you do that makes yourself worth that?" I can tell you I struggled a little bit with the pricing on this in the beginning because of that. I think if it was something that hurt a lot or caused a lot of pain, or a big recovery, they'll be like, "Oh yeah, that procedure was $1,000, but look at what I went through and look at my results." But it was hard to price that and get patients to come in and pay because they thought it was not really that aggressive of a device. So this is one where I had to reassess my strategy, change it a little bit, but now that we have the results, we've been able to bring the price up. So with the shower again, there we go. So this is a treatment that was made popular by Paula Abdul, Rockstar Treatment. Dr. Tess, a famous famous physician out on the West Coast, really made this popular with when she did these treatments. So patients will ask for this. So this is something they can do before a major event. This is in all transparency how I got hooked on the device. So I heard about it. I didn't buy it. I said, I'm not getting another device in the practice. And I was teaching at a seminar in New York. And for some reason, I was in a weak moment because I usually don't have procedures done to myself, especially at events, because I'm at a lot of events. And I'm like, I don't want to look too inflamed or red. But for whatever reason that afternoon, I was like, yeah, let's try it. And so I did exactly this treatment. And I looked great for the rest of the week. And everybody's like, oh, wow, what did you do? What did you put on your skin? Did you have, something done? And so then a few weeks later, I was somewhere else, and they were there, and I did it again and had a similar result. And that's when I started thinking, maybe I will bring it into the practice. Because if I'm seeing these results, is it just me, or is it something we're going to be able to repeat? But I can tell you, if I love it this much, patients are going to love it. So if they have something coming up that weekend, and we need a quick glow, but we also want them to get long-term results of collagen and elastin production, this is a device that we can use for that. So it's not something that required downtime, but that immediate result that they would see is what they would pay us the money for. So if they have a wedding, a family reunion, a bridal shower, things like that, they come in and get the treatment on Wednesday. By Sunday or Saturday, they're looking great. So this is the triangular tip that I was talking about. And so these are going to be nano bolts. And you can imagine as this is generating plasma, it's spreading that energy out wide across that entire tip. And so that is why this is nano ablated. As we move into the more ablative ones, I'll show you a different shaped tip and why that's going to focus that energy. So this nano bolts working in the skin, that plasma is what's going to cause our immediate tightening and lifting. And so they will see it right away. If you guys stop by the booth and get a demo treatment on yourself, you'll see. We can do it on one brow, one eye. Look at your other side, you'll see that there's an immediate lift from that. And we can do that all day long. That is not really your long-term result. So I always say that's a little bit like a trick. It'll last for a few days, maybe up to a week. It's not going to stay like that. What we're really wanting to do is stimulate those fibroblasts to make collagen and elastin. And that collagen and elastin is going to start to kick in. You're going to start seeing some improvement in that around 3 to 4 weeks. And that is when you're going to get the gradual tightening. That is where your before and after photos are going to be really important because they'll have that immediate result. They're going to forget where they started, and you're going to need to show them, just like that lady that I showed you her first photo, their before and after, and that's going to be weeks later. You can see that we can use this triangular tip. This is an example of a treatment in process. We can use it anywhere on really the face of the body, but one of the most popular areas for an immediate lift and tightening is on the eyelids. You'll see that it's being performed on the eyelids here, and this is with no numbing on this patient, and you can see they look fairly comfortable. Okay. The next step in this treatment, obviously, is going to be what we do for our immediate post-procedure, and then what the patient's going to take home and do for their aftercare. Now, this is where, in our practice, we use the ActoFeel line of products. So ActoFeel is a product line. They have, right now, 2 products. They're about to bring a couple of more in, but they have ActoFirm and ActoReverse. So these are a hyaluronic acid serum. They have a CD44 signaling molecule in there. So this is a molecule that's going to signal your fibroblasts to make more collagen and elastin. The reverse, the ActoReverse, it actually is going to have some other brightening agents. It has more amino acids to support collagen formation in that, and it also has things in there to help even out skin texture and skin tone. So for a lot of these treatments, I like to combine it with the ActoReverse. And then I know many of you signed up for this based on seeing some advertisements for the glass lift that we're going to talk about in just a second. But it's the same procedure. So this is our ActoFeel. So this is the one that does not, the ActoFeel, there's a lot of confusion around it. ActoFeel is the product line. So think about that as your main brand. But the products within that line are going to be ActoFirm and ActoReverse. So the ActoFeel itself is not a individual product. It's the product line. Okay. Glass lift is where we're going to be combining that product with our neurotoxin. So I don't know if any of you are doing microneedling now, where you're doing microneedling with some sort of hyaluronic acid and neurotoxin topically, but a lot of your patients may ask for glass lift, dolphin skin, jelly skin. There's all sorts of things that's referred to, but it's kind of just this smooth, tight appearance of the skin. And that's usually where we're putting our neurotoxin superficially and getting that transient result. And we've done that for a long time with microneedling. We can also do this with our Plexer shower. And so that's where we're going to put 40 units of our neurotoxin in with whatever the other serum. In this particular protocol, we use ActoReverse. So it's the kind of the stronger one, if you'll think of it that way. It's got more of the amino acids to support collagen production, the hyaluronic acid that's non-cross-linked, and we combine that with 40 units of neurotoxin. The patients will get a result from this they're going to start to see the result around a week, and it's going to last for around 4 to 6 weeks where it's really tight. The collagen production should then be kicked in by that point, and so they're going to have a long-term result from the collagen production. From the neurotoxin, it's going to be probably somewhere around 4 to 6 weeks. So if they really love that look and they want to maintain it, they're going to have to get it again after about 4 to 6 weeks. This is 2 months afterwards. You can see, again, the dyschromias are drastically improved there. So look at this skin texture and tone. You'll see that on the lower lid, the laxity, and the upper lids, also it's maintained. This is 2 months after one. So some patients, she's on the younger side, so, she's in her 40s, and so she'll maintain that a little bit longer than a patient that's going to be in their 60s. Okay. So I want to go over the CAT resurfacing. So this is the details on this. If you guys want access to this, stop by. We have the slides on that in the brochures. You can use the QR code there to follow and read about it. But to me, the key of this product line is a CD44 receptor activator. That is really what sets us apart and makes it different. I did use this product line in my practice before I got the Plexer. So I've used this as a standalone, not just with the Plexer. You can just get the product. I used this with my microneedling long before I got the Plexer, because our patients notice a difference with when we switch from our other hyaluronic acid serum to this. Okay. And again, we can provide you, this is the details on how it works, but we have about 6 minutes left, so I want to make sure that we get into the details of our fractional CAT resurfacing. So we go from using this wide triangle-based tip that's spreading out energy across the wide tip kind of diffusely and creating these microchannels, to a procedure that's going to be semi-ablative. So the first one we said is nano-ablative, no downtime, no numbing. This one's a little bit more aggressive. And so what we're doing is we're switching the tip, and we're changing from that triangular-shaped tip to more of a needle-shaped tip. And that needle is going to deliver the energy in a much more focused fashion. So now we're going to make minimal contact with the skin. It's focused energy to this needle tip, which is going to be a little bit more aggressive. So this is going to be semi-ablative, and we can get more drastic results. So you'll see that there's a lot of different ways we can do it. We can do dots, we can do lines. We really recommend the lines. That is the actual technique. And when we overlap the lines, we're going to get more drastic stimulation. So the tighter that grid is, the closer we put the lines together, the more we overlap, the more aggressive the treatment, the better the results. You'll notice there's quick healing with this. So as you go around the circle there, you're going to see the before, immediately after day 1, all the way up to a week. And so I usually tell the patients they're going to be red. They have little scratch marks on their face, especially the first day afterwards. Usually by day 2, it doesn't look like they've had much done at all. And by a week, it's totally healed. But they're going to get their real results usually somewhere around 3 to 4 weeks afterwards, like any other collagen stimulating treatment. You'll notice this tip looks a lot different. So you can see there that it's more, of a needle type tip. We even have an additional tip that's thinner than this. So the smaller that tip, the more the energy is going to go through that tip. So there's even a smaller one than this that we can really focus that energy. Now you notice here that there is, so as we're working in the glabellar region, those upper lines, that the kind of saran wrap that you see there is just an occlusive for the topical anesthesia that the patient has on. So we do anesthetize for this. The first one we didn't do numbing. This one is a little bit more uncomfortable, so it is a little bit more spicy. So we do provide some sort of topical anesthesia for this. You can do this technique on the upper and lower lid without doing the ablative. So kind of those results I showed you in the beginning with the little dots is when we're using the ablative technique. We can also use this technique where we're scratching, so it's less downtime. But to get the same results that we would get with the ablative technique, we would probably need to do 2 or 3 of these sessions compared to 1 of the ablative technique where it's 1 and done. But a little less downtime with this. We can do this in the submental region, on the neck, the décolleté. You see it's a quick treatment. So if we're doing just like a full face and neck, it's probably going to be somewhere around a 20-minute procedure. If we had the décolleté a little bit longer, This is again a neck, and so again horizontal lines here. So we will get tightening and lifting. So it's not just going to be a temporary, erasing of the lines. We're going to get tightening and lifting of the area that we're treating. Here's some average prices for each session. The tips are the same. So what you have to buy for each treatment is going to be those little tips. So the triangle tip, the needle tip, those are the per patient disposables that you would need, and they're $20. Now, whatever product line you use, you could put that on immediately afterwards. So obviously you have to factor that into your cost. But for the device itself, the little tip is all that you're going to need. So really a low per patient cost. Okay. We can use it also, this same cat scratching technique. We can use it if any of you are doing hair therapies in your practice. You can use this. So it's going to improve the hair growth by angiogenesis. So that scratching technique that you see stimulates the hair follicles there. We're going to have improved blood flow to that. So the follicles then get stimulated. And we can put something on there topically then, whether it's any of the serums that you're using. There's some hair lines out there that you're going to get better absorption of that. But you could even do this with your PRP. So for those of you doing PRP, PRF, any of those things, you could do the cat scratching technique and then put that on, and those channels that you create are going to improve the absorption of that PRP for better results. Okay. This is an example of using that technique that you can see that they shaved that off. If you have no hair at all, so this patient did have hair, it was shaved for this procedure, but if you have no hair at all, obviously it's not going to grow hair where the follicles are already totally done. So that's the only caveat. And with hair, the other thing that I really caution you all that it's a lot of things that go into hair therapies. So make sure that you're thoroughly evaluating your patient for other medical conditions that could be contributing to hair loss. And don't just do a procedure and hope the hair is going to grow there. All right, so we have a couple of minutes left, and I want to leave some time for questions from you guys. So any questions? Hi, Brandon. Yeah, that's a really good question. So is there an amount of downtime between if we're going to do recurring treatments? So thinking back and going back to some of the original slides that I told you guys about the mechanism, remember that we're not creating a lot of thermal damage. So there's not downtime associated with this that they need to heal. So we really could do this every week if we needed to, but there's not a need to do it every week. So I'm not creating thermal damage where I'm worried about, hey, that's not healed yet, so I don't need to go right back over it. And so especially with the nano ablative, that tip. So I can tell you, again, for me, I've done it, every week. I haven't done it in a while now, I need to, but I did it every week for a while because if I was going to an event, I was like, let me just do this quickly. It's not going to cause damage. I'll get a quick lift, so it's great for that. But from a patient standpoint, it's not going to be something they're going to come in and pay for every week. And so if we wanted to space the treatments out, what I like to do, my memberships in my practice are all based around biostimulation techniques. So I love things that are going to help the patient make their own collagen. So we package this as part of a membership program. And so it's one of the treatments they can get on a monthly basis. If they're doing the more ablative therapies, obviously they need to fully heal from that. It's going to take somewhere for us to see the results somewhere around 4 to 6 weeks. And so I tell them you can do one of the showers in between, but there's really no need for us to do it before a couple of months because we want to see those full results. So somewhere between 1 to 2 months. The protocols that we'll teach you if you bring the device into your practice, it really focuses a lot on the age of the patient. And so if we have somebody younger that's going to make collagen more vigorously with one treatment, we usually tell them 2 to 3 treatments a year is ideal. If we have somebody that's in their 60s and above and we know that they're going to need a little bit more of any procedure that we do, we usually tell them that they're going to need something about every other month. So they're going to need about 6 in a year. So then there's a range in between and we customize it to that patient. Great question. Yes? So again, that depends on your state. And so every state has varied. So the question is, what type of license do you require? This is something that's easily delegated in most states to estheticians. However, there are a few states that will say that anything beyond the stratum corneum cannot be touched by somebody that's not medical. So definitely check with your own state laws and your own attorneys. But this is something, depending on which tip you use, that can usually be delegated. A lot of states, it will be delineated by the type of procedure. So if you're doing the nano or non-ablative with the triangular tip, that can be delegated. If you're doing more of the soft surgery with the needle tips and you're actually removing tissue, that is going to be whoever can do that in the state, which is usually going to be an NPPA or physician. Yes?
So I know that, like, whenever you do a procedure in your practice, you encourage them to use the products that Actifil. But do you bundle it, like, you bundle something so that you are sure that they're taking that home to use, or?
Yeah, great question. So when we encourage them or we have something as a procedure that we need them to use to get the result, how do we bundle that in the practice? And I think that that's really important for any procedure that you're doing. So to me, if I need them to do a certain step, and I think that that's critical to the result, then that is bundled into my price of the procedure. And that's going to include there. So that way they're not able to pick and choose a la carte. And if it's something that I just want them to use, but it's not actually an integral part of the recovery, then I will usually offer that at some incentive. Like, if you do this, you'll get 20% off. But the reality is, if I want them to wear sunscreen, but do I really care if they use the sunscreen from my office or, what they've been using for years? I don't care. I'm not going to bundle that. But like the Actifil for these procedures, it's bundled in because I do feel that that is a crucial part of it for the result. So as we price these procedures in our practice, that is a factor of the cost. And they get to take that home with them.
Can you use this anywhere other than the face?
Yes, you can use it all over the body. And actually we have, entire classes on using it in different areas. There's and when we talk about sexual health, you guys, any of you that follow me on social media know that's a big part of our practice, males and females. And there are actually tips for this that we can use intravaginal. And so there's a lot of different indications that we can do on the body as we're, reshaping things, as we're doing, you can do labiaplasties with this, depending on the degree of laxity there and how you're going to try to change the shape of that. You can treat scars. So very common area to treat is breast scars. So after breast lifts, the anchor type of scars, some people will keloid from that. Some people have a lot of discoloration. Easily can treat that. Tummy tuck scars. Stretch marks is really great for that. It is a series of treatments if you're going to treat the stretch marks. But yeah, you can treat all over the body with it. Did you have another question?
Any issues with skin types that's 5 and 6?
Yeah, so no issues. You can treat all skin types based on that thermal protocol that we were going over. We do adjust it for 5 and 6. So you don't treat them as aggressively with the higher power tips in your first session. So it is something that you can treat all types, but there is a slight adjustment to the protocol. Okay. Other questions? All right, well, thank you guys so much for attending. We will be at the booth. We'll be up here. You guys can talk to us. I don't know the booth number. It's kind of in when you go into the left. So stop by and see us and you can get a treatment. 526. There you go. Thank you, Sienna. 926. 926. Thanks, Sienna. So this is Arash. He's the owner of the company. If you guys see him, we have Sienna up here. She's great and she's a good resource for you guys. And I'll be happy to hang around up here for a little bit and take any questions that you guys may have personally. Thanks for waking up early.